I'm going to talk this morning a bit about questions of privacy and security and data breach notification, primarily under U.S. rules, but I think in principle these issues are relevant to EU, Canadian rules, and others. What's broken, what might be fixed, how this all applies to a Medicine 2.0 environment, and what we can do about it. So when it comes to healthcare privacy and security, we're really caught betwixt and between. We're being pulled in different directions. The initial HIPAA regulations and their revisions under the High-Tech Act have been sort of flowing through the environment here in the U.S., but we're still waiting for final regulations, final consolidated omnibus HIPAA regulations. They were supposed to have been out a couple of months ago. We're still waiting, don't know when they're going to come out. There may be some changes, maybe significant, maybe not significant, but at any rate, we don't yet know what those will be. In the interim, we need to be planning for that future and figuring out how healthcare providers and other holders of information on the one hand and patients on the other hand can deal with these privacy type issues. So, on the one hand, we have organizations such as the Center for Democracy and Technology, even the United States GAO, Government Accountability Office, saying that HIPAA is broken. And that's sort of the nature of legislation and regulation. If you have a law that's passed to solve an existing or a past problem, by the time it actually gets enacted and implemented in regulation, the world has changed. So we're always playing catch up if we're trying to deal with this through the legislative and regulatory process. At the very least, even if we don't want to have changes to the rules, there may be need for improved oversight and guidance efforts from the regulatory agencies. On the other hand, there are many patients who would rather be able to share more information than they do now. People who have shared data through websites like Patients Like Me, our touchstone example for this conference, and who want to share personal information about themselves, their conditions, in order to seek help and to seek management of their conditions, and as we've heard, in order to help others as well. So, I think we can all agree that the laws and regulations in question are essentially out of date because of the pace of change, not only in society in general, but in particular because of the technological imperative that we have in this arena. So let me give a concrete example from HIPAA rules. In order to be considered to be a de-identified patient record, there are 18 categories of information that need to be stripped from a patient record. Okay? Name, address, et cetera, social security number of other factors as well. Anybody know what number 18 on the list is? It is anything else that could be used to re-identify de-identified data. And of course, that bucket doubles every week, right? Because there's that much more information on the internet. So people run into trouble. They think they've de-identified information when in fact they haven't. Or perhaps they have, but tomorrow it's no longer de-identified under HIPAA. So it's a tremendous problem. How do people deal with this? So we talked about some folks talking about the need for more stringent regulation. So one outspoken advocate for more stringent regulation of privacy and security of patient data is Deborah Peel, who is a psychiatrist, I believe, in Texas. She and others got Texas legislature to pass legislation, which is now in effect, the implementation schedule for which is up on the Texas Medical Society website under their Calendar of Doom section. It's a very aggressive policy. It includes a lot of things that are not included under HIPAA, things that sort of would make sense, I think, to people in this room. I've seen clients in the past year or so who are not by any stretch of the imagination covered entities or business associates under HIPAA, yet they are handling and touching information that any patient or consumer would think of as protected health information. So I don't want to be in a situation where something happens to a client's online database or server and there's a breach of data, and our response to patients who realize that their data has been breached is say, well, we're not covered under HIPAA. This doesn't matter. So what? Can't be in a position to say that. So some of us are already ahead of the curve and acting as if we're covered by HIPAA even if we're not. But Texas is taking a mandatory approach and saying a whole raft of other kinds of folks are now going to be covered by HIPAA-like rules. And the fun thing is, if you're doing business with anyone in Texas, Texas says that you're covered by their rules. And you have to train your staff to Texas rules. That's one of the joys of working in a regulated environment in the U.S. because you have 51 different systems to deal with. So our whole notion of privacy has really evolved in an age of social media, right? The things that we post online, we would not have told our neighbors 5 years ago. Anybody disagree with that? No. I'm constantly amazed at what my kids post online. They're constantly amazed at what I post online. And it's astonishing. So our legal system governing privacy has not evolved at the same pace with which we have changed the way we share private information. There's certainly situations where healthcare provider organizations could be doing a better job protecting privacy and security of health information. One of our local healthcare organizations was in the paper recently because their psych records were made available to all clinicians in the system, not just the psych clinicians. But some folks don't want the rules tightened up too much because it makes daily tasks harder to complete. And frankly, many, but not all, but many of the breaches that have been identified under HIPAA high-tech and posted on the Health and Human Services Wall of Shame really have no real-world effect on patients. We're talking about laptops stolen from rental cars by junkies and sold. Nobody's looking for the health data on the hard drive. Yet, if it's unencrypted, it gets reported on the Wall of Shame. Okay? Now, who does that help? I'm not really sure. There are, of course, real breaches that have the potential for real harm, but those are fewer and further in between than some of these other things that we're talking about. And here again is the psych issue. This is front page of the Boston Globe. Somebody realizes that her psych records are being accessed by her internist and wondering, why is this happening? Yes, they're in the same health system, but so what? This is computers, folks. We should be able to segment the access rights of different people in the system. So in other contexts, we share so much information, as I was saying. But in healthcare, it's really a small vanguard of patients, e-patients, engaged, empowered, enabled patients who are doing this sorts of sharing. But the numbers are growing. And we even hear that elderly Parkinson's patients are interested in sharing information if it's going to be helpful to someone. So we can put aside concerns about privacy because the sharing can really pay off in a big way. How can that happen? If we're serious about Medicine 2.0 helping patients and helping populations, we need to systematize the ability to share on a custom-tailored basis. We can address this either with better protections, clearer permission to share openly, but that all needs to be controlled by the patient, right? And what one researcher calls context-relative informational norms, how's that for a buzzword? What I tell my doctor, I don't tell my banker. Okay, I can handle that distinction. The local healthcare system apparently wasn't able to handle those kinds of distinctions. But in this article, it's argued that the real problem is the inappropriateness of the flow of information due to the mediation of technology. So it's not that somebody's stealing a laptop. It's the issue that people are sending and receiving messages, different types of information, and they have very different types of expectations about how it's going to be used and who's going to be using it. And when those expectations are violated, that's when we have privacy violations. That's where the issue is. So let's talk about modes of sharing that patients can enable and authorize. Okay, this is a picture of the blue button. People familiar with the blue button? Veterans Administration health record system, that you press the blue button on their electronic health record if you're in that system, and you get a flat ASCII file of your medical record. Not particularly useful, but it is an immediate delivery of your electronic health record. That is now being transitioned to the private sector, some of the private payers are using this as well. So on my jacket, which some of you have seen over the past day or so, one of the items here is a friendship bracelet, rainbow-colored friendship bracelet, and that symbolizes a conceptual rainbow button. So we have a blue button, okay? And the issue for patients is that we should be able to enable sharing of information and slice and dice that information and the permissions in whatever way makes sense to us as individual patients, okay? So it shouldn't be a question of, I don't have access to my data, somebody else has a backdoor into my data and is using it and is selling it. I, as a patient, perhaps ought to be able to control that. And in fact, I'd like to posit, put out on the floor for discussion, maybe we should have a robust market for personal health data with the patient at the center rather than the companies who are collecting the data at the center. And this approach would let the patient choose between the lockdown and the open door. Thank you very much. One question?
You can have two or three. I'm a physician from Sweden, and we have a healthcare record and so forth. What's your opinion about me, before I have a patient coming to my visit, that I Google my patient?
If it's public, it's public. You haven't violated anything by Googling someone.
But he could also stand on the street in front of someone's house, and that's not against the law. Just kind of stand in the street and stare at their house.
It's a little more creepy, but I'm sorry.
So what's the big deal? But then you forget about in normal human everyday life.
Right, we don't really do that. Right.
And how much valuable information can you get from Google about your patient anyway?
So the example I mentioned earlier, someone was able to look at public information and see the patient had misunderstood the take-home instructions about drug therapy or whatever it was, and was able to then correct that later on. That could have been accessible via Google or in that case, I think it was via Facebook on a public page. I don't see that as a problem because it is open information. Again, a patient may perceive it as creepy, but I think with the proper introduction and explanation of why you're doing this, how you're doing this, not on the day when you disclose the fact that you've seen something particularly creepy on Google, but as part of your practice's intake policy, then I think it works, and people appreciate the fact that you're not just spending 5 minutes with them in the office, you're really looking out for them. Yes?
I'm going to disagree with you a little bit here. So sure, we can find information on Google, and you say it's publicly available. Yet we have a long history of confidential records being trawled by Google because someone else screwed up. So this is not information the patient ever put out there. It's not information they chose to put out there. In fact, it wasn't even information that anyone deliberately chose to make available. Now, that's not actually public information. Do you still see that there's no privacy concern here?
Fair enough. I mean, if something is clearly recognizable as something that shouldn't be out there, then I would say lay off. But we can't, each of us, be confidentiality and privacy policemen.
Well, but how do I identify clearly shouldn't be out there?
So, I mean, there have been breaches and inappropriate disclosures of things that are clearly private information. Okay, for example, lab results in a university health system server are suddenly searchable by Google. That's sort of maybe an obvious thing.
How about something like library borrowing records?
Mm-hmm. Mm-hmm.
Are those public?
Well, my hometown library's policy is to scrub their data regularly because they don't want it to get exposed. Yeah, right. It's a problem.
All right.
Thank you. I'm getting the hook here. Thank you very much.